Okay, thank you very much. My name is Firafis. I'm psychology instructor. Currently, I'm a PhD student in Addis University in applied developmental psychology. Today we're going to see psychological disorder course. This course is basically have the following chapter outline. The first part is basically include what are psychological disorder and diagnosing and classifying psychological disorders and the perspective on psychological disorders, and anxiety disorder is well included in part one. And the second part is basically consists of this obsessive compulsive and related disorder, post-traumatic stress disorder, and mood disorders. And finally, schizophrenia is included in part two, and whereas part three is included dissociative disorder, personality disorder, and a disorder in childhood. This is the whole chapter outline. And when we come to the chapter one or part one, what are psychological disorder? Psychological disorder is a condition characterized by abnormal thoughts and feeling and behaviors. And this is basically psychopathology in the study of psychological disorder, includes their symptom and etiology, their causes and the treatment. And the term psychopathology can also refer to manifestation of psychological disorder. Therefore, this is one most important, what psychological disorder is. With understanding psychopathology, whether the causes and the symptoms, it may help us. Again, further, this psychopathology, understanding psychopathology, again, help for treatment. Although consensus can be difficult, it's extremely important for mental health professional to agree on what kinds of thoughts and feeling and behavior are truly abnormal in the sense that they genuinely indicate the presence of psychopathology. So it's difficult to make a kinds of conclusion and make a kinds of agreements due to different factors. So certainly certain pattern of behavior and inner experience can easily be labeled as abnormal and clearly signify some kinds of psychological disturbance. There, for example, a person who washes his hand 40 times per day, and the person who claims to hear the voice of demon exhibit behavior and inner experience that most would regard as abnormal, belief in the behavior that suggests the existence of psychological disorder. Therefore, this feeling may not be regularly present and that they fall in range of normal. So what kind of thought and feeling and behavior represent truly psychological disorder is a question. Psychology wants to distinguish or differentiate psychological disorder from the inner experience and the behaviors that are merely situational or unconventional. Therefore, how we can define what is the universal acceptance of definition of psychological disorder? Perhaps the simplest approach to conceptualizing psychological disorder is to label behavior first, and the thoughts and inner experience that are typically and distressful, dysfunctional, and sometimes even dangerous and a sign of disorder. Thus, for example, labeling behavior and the thoughts, inner experience, typical, distressful, and dysfunctional, sometimes when one that is dangerous, that they're considered as psychological disorder. For example, if you ask classmate dates and you reject it, probably you feel little dejected or sad. Such feeling would be normal. If you feel extremely depressed, so much so that you lost interest in activity, had difficulty eating or sleeping, felt utterly worthless, and contemplated suicide, your feeling would be atypical, would deviate from the norm, and could signify the presence of psychological disorder. So our action, our thoughts, our feelings sometimes deviated, and if it is frequently deviated from societal norm in a culture that consider a label as or signify or it indicates the existence or the presence of psychological disorder. Just because something is atypical, however, does not necessarily mean it's disordered. For example, only about 4% people in the United States have red hair. So red hair is considered as typical characteristics. You can see from your handout, figure 1.2, but it is not considered as disorder. It is just unusual, and it is less unusual in Scotland, for example, where approximately 30% of population has red hair. That's very important. So you can see from your handout, if you agree that merely being typical is an insufficient criteria for having a psychological disorder, it is reasonable to consider behavior or inner experience that different from widely accepted cultural value or expectation as a disorder. Using this criteria, a woman who walks around the subway platform wearing a heavy winter coat in July while screaming obstetrics in stranger may be considered exhibiting system of psychological disorder. Here, action and clause violate social accepted rule and governing appropriate dress and behavior, thus characteristics are typical. So what most important thing is considering cultural expectation is very important here. And this cultural expectation is violating cultural expectation is not in and of itself satisfactory means of identifying the presence of psychological disorder, since the behavior varies from one culture to another. What may be expected and considered appropriate in one culture may not be viewed as such in other cultures. For example, returning stranger smile in expected in the United States because pervasive social norm detect what is reciprocate, friendly gestures, and the like. So this is one most important, considering or understanding cultural expectations is basically most important. And in hallucination, seeing or hearing things that are not physically present in Western society is a violation of cultural expectation, and a person who reports such inner experiences readily labeled as psychological disorders. In other culture, for example, vision that, for example, pertain or relate to future events may be regarded as a normal experience that are positively valued. Finally, in general, it is important to recognize that cultural norm change over time. May it be considered typically a society that one time may no longer viewed this way later, similar to how to fashion trend from one era may lead or looks decade after. Therefore, this cultural norm change over time or considering is very important. The other issue considered in this issue is that measure of the mental illness. For example, in 1950s and the 1960s, the concept of mental illness was widely criticized. One major criticism focused on the notion that mental illness was a means that justified psychiatric intervention in society disapproved behaviors. For example, known scholars Thomas says 1960 notes that it's actually psychiatrist was perhaps the biggest proponent of this view. He argued that the notion of mental illness was invented by society and the mental health establishment to stigmatize and subjugate people whose behavior violates accepted social and legal norms. Therefore, this is one most important. Today, we recognize extreme level of psychological suffering experienced by people with psychological disorder, the painful thought and the feeling they experience, the disordered behavior they demonstrate, and the level of distress and impairment they exhibit. This makes it very difficult to deny the reality of mental illness. However, according to the scholars, view and those of the support they have influenced the mental health community and the society in several ways. For example, lay people, politicians, and professionals now often refer to mental illness as a mental health problem, implicitly acknowledging the problem in living. Also, other scholars, homosexuality, for example, was perhaps the most psychiatrists openly challenged the idea that homosexuality represents the form of mental illness or disease. By challenging the idea that homosexuality represented a form of mental illness, according to Sanchez, helped pave the way for social and civil rights that gay and lesbian people now have. Therefore, that's most important things. The other issue is the harmful dysfunction. If none of the criteria in this case so far is adequately by itself to define the presence of psychological disorder, how can a disorder be conceptualized? Many efforts have been made to identify the specific dimension of psychological disorder, yet none is entirely satisfactory. No universal definition of psychotic disorder exists that can apply to all situations in which the disorder is thought to be present. However, one of the most influential conceptualization was proposed by Wakefield 1992, who defined psychological disorder as harmful dysfunction. He argued that natural internal mechanism, that is, psychological process honored by evolution, such as cognition, perception, and learning, have important functions, such as enabling us to experience the world the way others do and to engage in rational thoughts, problem solving, and communication. For example, learning allows us to associate fear with potential danger in a such way that the intensity of fear is roughly equal to the degree of actual danger. Therefore, dysfunction occurs when the internal mechanism breaks down and can no longer perform its normal function. But the presence of dysfunction by itself does not determine a disorder. Therefore, the dysfunction may be harmful in that it leads to negative consequences for individual or for others as judged by the standard of individual culture. Therefore, this most important, the harm may include significant internal anguish, high level of anxiety or depression, or problem in day-to-day living in one social or work life. Therefore, according to the harmful dysfunction model, the genetic condition would signify disorder because there is a dysfunction in internal mechanism, one. Second, the dysfunction is resulted in harmful consequence. This is more the model that different scholars proposed, state that there is a dysfunction in internal mechanism. Second, the dysfunction are resulted in harmful consequences. Therefore, the internal mechanism component of this model, for example, is especially appealing because it applied that disorder may occur through breakdown of biological function that govern various psychological process, thus supporting contemporary neurobiological model of psychological disorder. And according to American Psychological Association, APA definition of this is that there are three most important criteria, condition to consist for psychological disorder. One, there are significant disturbance in thought, feeling, and behaviors. Second, the disturbance reflect some kind of biological, psychological, and developmental dysfunctions. Therefore, this is the second most important conditions that must consist of psychological disorder according to APA 2013. The third criteria is that the disturbance leads to significant distress or disability oneself. For example, a person's inner experience and behavior are considered to reflect psychological disorder if they cause the person considerable distress or greatly impair his ability to function as a normal individual, often referred to as functional impairment or occupational or social impairment. That's important. The fourth and the most important criteria according to American Psychological Association is that the disturbance do not reflect expected or culturally approved response to certain event. That's the fourth criteria. Some believe that there is no essential criteria or a set of criteria that definitely distinguish all cases of disorder from non-disorder. In truth, no single approach in defining psychological disorder is adequate by itself, nor there is a universal agreement on where the boundary between disorder and not disorder. Thus, inner experience and behavior vary in their intensity, but are only considered disorder when they are highly disturbing to us or to others, suggest dysfunction in normal mental functioning, and there are associations with significant distress and disability in social or occupational activities. In summary of chapter, psychological disorder are a condition characterized by abnormal thoughts, feeling, and behavior. Although challenging, it is essential for psychologists and mental health professionals to agree on what kind of inner experience and behavior that are atypical or violate social norm could signify the presence of disorder. However, each of the criteria alone is inadequate. Harmful dysfunction describes the view that psychological disorder results from inability of internal mechanism to perform its natural function. Many of the features of harmful dysfunction conceptualization have been incorporated in APA style formal definition of psychological disorder. According to this definition, the presence of psychological disorder is signaled by significant disturbance in thoughts, feelings, and behaviors. The second area, topics under part 1 is diagnosing and classifying psychological disorder. The first step in psychological disorder is carefully and systematically discerning significant signs and symptoms. Appropriate identifying and labeling a set of defined symptoms is absolutely crucial and very important. This process enables professionals to use a common language with others in the field and aid in communication about the disorder with patients, colleagues, and public. A proper diagnosis is an essential element to guide proper and successful treatment. For this reason, classification systems that organize psychological disorder systematically are necessary. Diagnostic and Statistical Manual of Mental Disorder, basically published in 2030, note that basically focusing on the first edition, for example, in 1952, classifying psychological disorder into formats used by a U.S. Army during Second World War. In the years since, the DSM has undergone numerous revision and addition. The most recent published 2030 DSM-5 is important. And according to this, include many categories of disorder. For example, anxiety disorder, depressive disorder, dissociative disorder is well incorporated. Overview of the disorder or diagnostic features, symptoms required for diagnosis, and prevalence information in the population affected with the disorder is, and again, risk factor is well incorporated. This is Gelila International Seminary for the course Psychological Disorder. And this DSM-5 also provide information about comorbidity, the co-occurrence of two disorders. For example, in DSM-5, mentioned 41% of people with obsessive compulsive disorder also meets the diagnostic criteria for depressive disorder. Drug use highly comorbid with other mental illness. 6 out of 10 people who have substance use disorder also suffer from another form of mental illness. Again, DSM has changed considerably in half century since it was originally published. The first two edition DSM, for example, listed homosexuality as a disorder. However, in 1973, the APA voted to remove it from the manual. Additionally, beginning with DSM third in 1980, mental disorders have been described in much greater detail. And the number of the diagnosable condition has grown steadily, as has the size of the manual itself. And DSM-1 included 106 diagnoses, and the latest edition, DSM-5, include version of the organization, naming of the category, and the diagnostic criteria for various disorders. Some believe that establishing new diagnosis may pathologize the human condition by turning common human problem into mental illness. Therefore, that is basically most especially DSM-5, however, has removed the bereavement and exclusion, essentially meaning that grief and sadness after a loved one death can constitute major depressive disorder. The internal classification of the disease, again, one another dimension in giving highlights and the general overview about this psychological disorder. And the second classification and the internal classification of disease, ICD, is widely recognized, published by the World Health Organization. The ICD was developed in Europe shortly after the Second World War, and like DSM has been revised several times. The category of psychological disorder in both DSM and ICD are similar, as are the criteria for a specific disorder. However, some difference exists. Although ICD is used for clinical purpose, for tool also used to examine general health population and to monitor the prevalence of disease and other health problem international. Therefore, this is basically more. In general, when the ICD is more used for clinical purpose, this tool is used to examine general health population and monitor the prevalence of disease. The studies that compared use of two classification systems found that the worldwide, the ICD is more frequently used for clinical diagnosis, whereas DSM is more valued for research. Most research finding concerns the etiology and treatment of psychological disorder also based on the criteria set for in DSM. The DSM also include more explicit disorder criteria along with extensive and helpful explanatory text. The compassionate view of psychological disorder, again, two things in mind. One, remember that psychological disorder represents extreme of inner experience and behavior. Second, understand that people with psychological disorder are far more than just embodiment of their disorder. As in the case with the cancer or diabetes, for example, those who psychological disorders suffer, they lead often painful conditions that are not of their own choosing. That is very important. In summary, diagnosis and classification of psychotic disorder is essentially in studying and treating psychopathology. The classification system used most US professional in DSM-5, and the first edition of DSM in 1952 has undergone numerous revision. Then the diagnostic manual total of 237 specific diagnosable disorder, which describe in detail, including symptom, prevalence, risk factor, and comorbidity. The perspective of psychological disorder, it seems the scientist and the mentalist professional may adopt different perspectives in attempting to understand and explain the underlying mechanisms that contribute to the development of psychological disorder. The perspective used in explaining psychological disorder is extremely important, in that it will consist of explicitly assumption regarding how best to study the disorder, its etiology, what kinds of therapy and treatment are most beneficial. Different perspective provide alternate way for how to think about the nature of psychopathology. The first and the most important perspective is the supernatural perspective of psychological disorder. For centuries, psychological disorder were viewed from the supernatural perspective, attributed to a force beyond scientific understanding. Therefore, such belief supernatural cause of mental illness is still held in some society today. For example, beliefs that supernatural force cause mental illness are common in some culture in modern day Nigeria, for example. The second perspective in relation to understanding the psychological disorder is the biological one. The biological perspective view psychological disorder as linked to biological phenomena such as genetic factor, chemical imbalance, brain abnormality. Evidence from many sources indicate that most psychological disorders have genetic components. In fact, there is still dispute that some disorders are largely due to genetic factor. Findings such thus have led many today researchers to search for specific gene and genetic mutation that contribute to mental disorder. Also, sophisticated neutral imaging technology in this recent decade have revealed how abnormality in brain structure and function may be directly involved in many disorders. And advance in understanding of the neurotransmitter and the hormone have yielded insight into the possible connection. Therefore, the biological perspective currently booming in study of psychological disorder. The third one is the DITS stress model of psychological disorder. Despite the advance in understanding the biological base of psychological disorder, the psychological perspective is still very important. This perspective emphasizes and focused the importance of learning, stress, faulty and self-defeating thinking pattern and environmental factor is key, most important. Perhaps the best way to think about psychological disorders then is view them as originating from combination of biological and psychological process. That is most important. Then this model integrates biological and psychological factor to predict the likelihood of a disorder. And it generally suggests that people with underlying predisposition for disorder are more likely than those others to develop a disorder when faced with adverse environment and psychological events, for example, stress, such as childhood maltreatment, negative life events, trauma. Therefore, this is one most important. In summary, psychopathology is very complex, involving different plethora of theological theory of perspective. For centuries, psychological disorder viewed primarily from supernatural perspective, thought to rise from divine force or possession from spirit. Some cultures continue to hold this supernatural belief today. Many who study psychopathology view mental illness from biological perspective, whereby psychological disorders are thought to result largely from the faulty of biological process. Therefore, the psychological perspective, the environmental factor, and the combination of the two is very important in understanding psychological disorder. Contemporary promising approach to view psychological disorder originating from integration of biological and psychological factors. That is very important. The fourth part is the anxiety disorder. Everybody experiences from time to time. Also, anxiety is closely related to fear. The two states poses important difference. Fear involved the instant reaction to immediate threats, whereas anxiety involves apprehension, avoidance regarding potential threats and danger and other negative events. While anxiety is unpleasant to most people, it is important to our health, safety, and well-being. Most individual level and the duration of anxiety approximate the magnitude of potential threat they face. Some people, however, experience anxiety that is extensive, persistent, and greatly out of proportion to actual threats. Anxiety disorders are generally characterized by excessive and persistent fear, and anxiety and related disturbance in behavior. Also, anxiety is universally experienced. Anxiety disorder cause considerable distress. Anxiety disorders are most frequently occurring class of mental disorder and often comorbid with each other and other mental disorders. The second one is the specific phobia. Phobia is a Greek word that means fear. Person diagnosed with specific phobia, formerly known as simple phobia, experience excessive, distressing, persistent fear or anxiety about specific object or situation, animal, enclosed space, elevator or flying, whatever it is. Even though people realize that the level of fear, anxiety in relation to the phobic stimulus is irrational. Some people with specific phobia may go to great lengths to avoid phobic stimulus, object situations that trigger the fear and anxiety. Typically, fear and anxiety, if a phobic stimulus elicits, it is disruptive to a person's life. For example, a man with a phobia of flying may refuse to accept jobs that require frequent air travel, thus negatively affecting his career. Specific phobia are common. For example, in the United States, around 12.5% of population will meet the criteria of specific phobia at some point in their lifetime. One type of phobia is agoraphobia, for example, in DSM-5, a separate anxiety disorder. Agoraphobia, which literally means fear of marketplace, is characterized by intensive fear, anxiety, avoidance of situations in which it may be difficult to escape and receive help if one experiences symptoms of panic attack. Therefore, this is one. Acquisition of phobia through learning is many theories suggest that phobia develops through learning. Richman, for example, in 1977, proposed that phobia can be acquired through three major learning pathways. One, the first pathway is through classical conditioning. The second one is pathway of phobia acquisition through vicarious learning, such as modeling. The third one is through verbal transmission or information. The other one is the social anxiety disorder. Social anxiety disorder, formerly social phobia, is characterized by extreme, persistent fear and anxiety and avoidance of a social situation in which a person could potentially be evaluated negatively by others. The heart of fear and anxiety in social anxiety disorder is a person concerned that he may act in humiliating or embarrassing way, such as appearing foolish, showing symptoms of anxiety, doing or saying something that may lead to rejection. This kind of social situation in which individuals with social anxiety disorder usually have a problem include public speaking, for example, having conversation, meeting strangers, eating in restaurants, and in some cases, using public restrooms. Adults with this disorder are more likely to experience lower educational attainment and lower earning. When people with social anxiety disorder are unable to avoid situations that provoke anxiety, they typically perform safety behavior, mental or behavioral acts that reduce anxiety in social situations by reducing the chance of negative social outcome. Safety behavior includes, for example, avoiding eye contact, rehearsing sentence before speaking, talking only briefly, and not talking about oneself. Our example, for example, the safety behavior includes assuming role in situations that minimize interaction with others, asking people may question to keep the focus off on oneself, selecting position to avoid scarcity or contact with others, sitting in the back of the room, wearing blunt or neutral clothes to avoid drawing attention to oneself, and avoiding substance or activities that may cause anxiety symptom, caffeine, warm clothing, physical exercise, and the like. And one of the most well-established risk factors for developing social anxiety disorder is behavioral inhibition. Behavioral inhibition or self-consciousness is thought to be inherited traits that are characterized by consistent tendency to show fear and restraint when presented with unfamiliar people or situation. It is displayed very easily in life. Behavioral inhibited toddlers or children respond with a great cohesion and restraint in unfamiliar situations. They are often timid, fearful, and shy around unfamiliar people. The other one is the panic disorder. Panic disorder. Let me read this scenario for you. Imagine that you are at shopping mall. One day, your friend, and suddenly and unexpectedly, you begin sweating and trembling or vibrating. Your heart starts pounding. You have trouble breathing and you start to feel dizzy and nauseous. This episode lasts for 10 minutes and is terrifying because you start to think that you are going to die. When you visit your doctor the following morning and describe what happened, she tells you that you have experienced a panic attack. You can see on your module figure 1.9. And people with this panic disorder experience recurrent more than one and unexpectedly panic attack, along with at least 1 month of persistent concern about additional panic attack, worry over the consequence of the attack, and self-defeating change in behavior relating to attack. A panic attack is simply defined as, in general, a period of extreme fear or discomfort that develop abruptly or reach a peak within 10 minutes. It is symptoms of the following. 1. Accelerate heart rate, sweating and trembling, choking sensation, hot flash or chills, dizzy or lightheadedness, fear of losing control or going crazy, and a fear of dying. And that's most important characteristics or symptom of this panic. Panic attack can occasionally hurt trip to emergency room because several symptoms. Panic attack, in fact, similar to those associated with heart problem, the important, and misinterpret them as sign something intensively wrong internally, thinking, for example, pounding heart represent invading heart attack and whatever it is. Therefore, panic attacks themselves are not mental disorders. Indeed, around 23% of Americans experience isolated panic attack in their life without meeting the criteria of panic disorder, indicating that panic attacks are fairly common. Many people with a panic disorder develop agoraphobia, which are marked by fear and avoidance of situations in which escape may be difficult or help may not be available if one develops symptoms of panic attack. People with panic disorder often experience comorbid disorder, such as other anxiety disorder and major depressive disorder. Children with high risk of developing panic disorder, if their parents have a disorder, for example, and the family and the twin state indicate that irritability or panic disorders are around 43%. Therefore, this is one most important issue. There are some cognitive factors for this panic disorder. Cognitive theory argues that, for example, those panic disorders are prone or likely to interpret ordinary bodily sensation catastrophically or triply. Thus, fear interpretation set the stage for panic attack. Therefore, such interpretation creates fear and anxiety, for example, which trigger additional physical symptoms. Subsequently, the person experiences panic attack. Therefore, that is most important. This is Gelila International Seminary for the course Psychological Disorder. Generalized anxiety disorder, the other one, is basically extremely worried, one symptom and a signal of this generalized anxiety. For example, relatively continuous state of exclusive, uncontrollable, and positively is worry and apprehension, one. People with anxiety disorder often worry about routine, everyday things, even though their concern was understood. Diagnosis in relation to this anxiety requires diffuse worrying or apprehension character of this disorder. For example, what Sigmund Freud referred free-floating anxiety is not part of another disorder, occurs daily than not for at least 6 months and accompanied by any other series of following: restlessness, difficulty of concentration, and fatigue, and the others one. The second part is obsessive compulsive related disorder. This compulsive disorder is a group of overlapping disorders that generally involve disturbing, unpleasant thoughts and repetitive or boring behaviors. This disorder is basic experience, thought, and urge that are unwanted, obsessive. They need to engage in repetitive behavior and a mental act. A person with disorder may, for example, spend hours each day washing his hand or constantly checking and rechecking to make sure a stove, a light has been turned off. Therefore, rather than obsession is characterized as persistent, unintentional, unwanted thought and urge that highly unpleasant and disturbing. Common obsessive include about germ and contamination, doubt, and other things. Bodily dyssomatic disorder is an individual. This disorder is perceived flaw in her physical appearance that either non-exist or barely noticeable to other people. Thus, perceived physical defect cause the person to think she is unattractive, ugly, and deformed. Thus, perception preoccupation can focus on bodily area, but they typically involve skin, face, and hair. The other one is the hoarding disorder. This is one most important. People with this disorder basically cannot bear to be part of personal position, regardless of how valueless or useless this position are. As a result, those individuals accumulate excessive amount of usual worthless items that clutter their living area. Therefore, importantly, diagnosis of hoarding disorder is made only if the hoarding is not caused by another medical condition and if the hoarding is not symptom of another disorder. What the cause of this obsessive compulsive disorder is basically key. The result of the family and the twins suggest that OCD has moderate genetic component. Therefore, there is a different genetic factor is one possible cause for OCD, and other optifrontal cortex, or especially this is because especially hyperactive when they are provoked with tasks in which, for example, they are asked to look at a photo or toilet or a picture hanging, crawling as well. Therefore, this is one possible, another factor. The other one is conditioning in OCD is basically one most important. The symptoms of OCD have been theorized to be learned response, acquired and sustained as a result of combining two forms of learning, classical conditioning and operant conditioning. This is Gelila International Seminary course for psychological disorder. In summary of part 2 is basically most important. Obsessive compulsive related disorder are a group of DSM-5 disorders that overlap somewhat in that way, in that they each involve thoughts and repetitive behaviors. Perhaps the most recognized of this disorder is obsessive compulsive disorder, in which a person is obsessed with unwanted, unpleasant thoughts and compulsively engage in repetitive behavior or mental act, perhaps as the way of copying these obsessions. And the bodily dysmorphic disorder characterized by individual become extensively preoccupied with one or more perceived flaw in his physical appearance that are either non-existent or unnotable to others. And the hoarding disorder characterized by persistent difficulty in discarding or parting the object regardless of their actual value, often resulting in accumulation of items that clutter and clustered with areas. This is all about part 2.